Okay, so let's talk about something that affects millions of women, but we just don't talk about it. We're going to get into piles, also known as hemorrhoids, and we're going to break it all down, clearly and without any judgment, using guidance from the medical experts at Arca and Nagraha Hospital.
I mean, let's just be real for a second. It's an uncomfortable topic, right? It can feel pretty embarrassing to bring up, but here's the most important thing I want you to hear. If this is something you're dealing with, you are so not alone. This is way more common than you think. So, our goal here is super simple. We're just going to give you clear, straightforward information. We want to take away the mystery and the stigma around piles so you can actually understand what's going on with your body and what you can do to feel better.
All right, let's dive right in. First things first, we're going to cover the basics. What exactly are piles? And, why do they seem to be such a common thing for women specifically? It's actually a pretty simple definition when you break it down. Just think about varicose veins that people sometimes get on their legs. It's basically the same idea, just happening in a much more sensitive spot. That comparison really helps make sense of what's physically happening. Now, this is where it gets really specific to women's health. Pregnancy is, of course, a huge one, all that pressure from a growing baby. But it's not just that. Even the normal hormonal roller coaster of your period or menopause can play a role. And then there's our modern lifestyle. Chronic constipation, or just sitting at a desk all day, puts a ton of extra pressure down there. Okay, so we know what they are and what causes them. But how do you know if you have them? Spotting the signs is really the first step to getting some relief. So let's talk about what you should be looking out for. These are really the main culprits. For a lot of people, seeing that bright red blood is the first sign, and yeah, it can be pretty alarming. You might also just have this annoying itching that won't go away or feel little lumps. And then there's that super frustrating feeling like you just can't quite finish, which of course can make you stream more and start a whole vicious cycle. And this quote, it just nails the feeling of discomfort perfectly. It makes it so tangible. Especially with external piles, the feeling can be this constant, distracting pain that's literally like you're sitting on a little rock all day. Now for a really important one for so many of us, piles during pregnancy and after having a baby. I mean, these moments in life are basically the perfect storm of factors that can cause them. This chart breaks it down so well. See, during pregnancy, it's the slow, gradual buildup of pressure from the baby's weight, plus all those hormones making your blood vessels relax. But after delivery, whoa, it can be much more sudden. The incredible strain from pushing can make new ones pop up out of nowhere or make any you already had way worse. But the good news is there are things you can do about it. These 5 steps are so simple but can make a world of difference. A sitz bath sounds kind of fancy, but it's just sitting in a little bit of warm water, and it's so soothing. Ice packs, a donut cushion to sit on, these are your best friends postpartum. Okay, and this is a huge one, so please listen up. If you're breastfeeding, you absolutely cannot assume that any old cream from the pharmacy is safe. You have to check with your doctor first just to make sure it's okay for you and your baby. All right, let's bust some myths because some of them are genuinely scary. The biggest one is the fear that it's cancer. Let me be clear, piles are not cancer. But, and this is a big but, you should always get any kind of rectal bleeding checked out by a doctor. It's just smart to rule everything else out and get peace of mind. Here's another one, that this is something that only happens to older people. Well, as we've already seen, that's just not true at all. Women of any age can get them, especially during those key life stages like pregnancy or if they're just dealing with chronic constipation. And finally, the big one, the fear of surgery. The truth is, the vast majority of cases don't even come close to needing surgery. Most of the time, some simple lifestyle changes and at-home treatments do the trick. Surgery is really just for the most severe cases that won't go away. So that brings us to the most powerful part of this whole conversation, how you can take control, how you can prevent piles in the first place, and how you can manage them at home to get comfortable again. Honestly, prevention all boils down to these simple, healthy habits. Getting enough fiber and water is absolutely key for keeping things, moving smoothly. A little gentle exercise like walking is great for circulation. Oh, and here's a big one for our modern world. Don't sit on the toilet scrolling on your phone for half an hour. And when you do have a mild flare-up, these are your go-to remedies. Soothing witch hazel pads can be a lifesaver, and there are plenty of over-the-counter creams that can help.
And of course, there's our good friend, the warm sitz bath, to ease that irritation.
But look, at-home care can't always solve everything, and this is a really critical point. You have to know when to say, okay, time to call in a professional. These right here are the red flags. If you're bleeding a lot, if the pain is severe and just not getting better with anything you try, or if you see any signs of infection, please call your doctor. Same thing if your symptoms are just dragging on for more than a week. Don't just try to tough it out. And when you do go to the doctor, they have a lot of tools in their toolbox. A lot of the time, it's a simple, non-surgical thing they can do right in the office, like rubber band ligation. Sounds weird, but it works. And then, for those really stubborn, severe cases, surgery is an option that can offer a permanent fix.
So what's the bottom line in all this? It's that you can do a lot to manage mild symptoms yourself, but maybe even more importantly, you don't have to just suffer in silence if things aren't getting better. There's no prize for being miserable, and there are real, effective treatments that can help. And that kind of leaves us with one final thought, doesn't it? We know this is common and we know it's treatable. So if you're struggling, maybe the biggest question is, could having that one, maybe slightly awkward conversation with your doctor be the first step to changing your everyday comfort and your health for the better?